Welcome back to LOVEPLUSPET channel. Today we are going to discuss how do you fix shoulder dislocation in dog. If your dog is suddenly having difficulty using one of its front legs, it may be experiencing shoulder dislocation. Shoulder dislocation in dogs, which is also known as shoulder luxation or subluxation, occurs when the shoulder joint becomes unstable and the humeral head pops out of the glenoid fossa. There are few causes for shoulder dislocations in dogs, but the most common is trauma and congenital malformation of the shoulder joint. Treatment depends on the cause and severity of the injury, but often involves surgery or supportive therapy. In this video, we will discuss the treatment options for a shoulder dislocation in dogs. What is shoulder dislocation in dogs? Shoulder dislocation in dogs is a condition where the dog's shoulder joint luxates or becomes subluxated. The shoulder joint is a ball and socket joint, and the socket is deepened by a lip of bone called the glenoid fossa of the scapula. In a normal shoulder, the ball fits snugly into this socket. However, in a dislocated shoulder, the head of the humerus luxates out of the glenoid fossa and becomes displaced. Shoulder joint dislocation means that the humeral head has completely come out of place with the glenoid fossa. Subluxation is when there's a displacement of the humeral head but is not fully luxated. How to fix shoulder dislocation in dog? If you want to increase the chances of a successful outcome, it is important to diagnose, reduce, and stabilize the luxated joint as soon as possible, regardless of the treatment method. Closed reduction. This is often the first step in treating shoulder dislocation in dogs. This is a procedure where the veterinarian manually puts the humeral head back into place within the glenoid fossa. Once closed reduction is successful, your dog will need to be immobilized for 4 to 6 weeks while the shoulder joint heals. Various slings can be used to support and immobilize the shoulder, such as splints. Surgical repair. The shoulder joint often requires surgery if it remains unstable after closed reduction. Depending on the type of luxation present, different techniques have been used to surgically stabilize the shoulder joint. Recovery of shoulder luxation in dogs. After closed or open reduction, you will need to limit your dog's activity. He will likely require the sling or splint for up to 2 weeks during the healing of his joint capsule. A follow-up examination will likely be necessary so that your veterinarian can make sure that your dog is healing well. During his recovery, it is a good idea to keep an eye on your dog to look for signs of swelling or discomfort. After the sling or splint has been removed, you could use elbow brace to limit your dog's activity to minimize the risk of additional trauma while the joint heals. LOVEPLUSPET Hinged Dog Shoulder Support Brace is a good choice for post-surgery dog to recover. Inner hinged provides support to the injury front legs and limit your dog's activity. If you are interested to this brace, there is more information about it. Thank you for watching.